Good afternoon, everyone. Welcome to this exciting Views from the Top session titled Global Health Informatics Competencies, Recommendations for Interprofessional Care Delivery. I'm Susan Heichert, a member of the HIMSS Board of Directors. On behalf of HIMSS, it's my pleasure to welcome you to this Views from the Top session. We're extremely pleased to have you here with us today, as well as throughout the remainder of the week. In today's session, we'll hear about the International Competency Synthesis Project and the EU-US eHealth Work Project and their implication for health informatics professional development. I'm pleased to introduce our speakers, Dr. Beth Elias, faculty at the University of Scranton, and Dr. Ursula Hübner, professor at the University of Applied Sciences in Osnabrück. Now, please join me in extending a warm welcome to our speakers.
Thank you, Susan, for the kind words, and thank you also for giving us the opportunity to present our results. My name is Ursula Hübner. I'm a professor of medical and health informatics and quantitative methods in Osnabrück, Germany, as Susan said. I'm a Tiger from the very beginning, and I'm involved in international Tiger leadership. You should also know that I am an educator in health informatics for more than 20 years.
And I'm Beth Elias. I'm on the faculty at the University of Scranton. We have an interdisciplinary master's in health informatics. I am also part of the HIMSS leadership, Tiger leadership. I was a past national co-chair of the Tiger Committee with Ursula Hübner as my international co-chair. I've previously served on the User Experience Committee under HIMSS and a number of task forces and work groups. I recently became a HIMSS Fellow, and I've been an informatics educator for not quite 20 years. Previously, I was a senior computer systems engineer in healthcare and also working with clinical trials. Where'd my...
Yeah.
Thank you. Okay, so this is our agenda. I won't bore you too much with that. And same with the learning objectives. You all have those already, so I don't waste our... It's unfortunately a staged slide here. Okay, here we go. So just a little bit about Tiger before we start the actual meat of the presentation. Tiger, as you can see, began as a grassroots initiative in 2006 by a number of educators and people concerned with the lack of informatics education in healthcare professions. In 2012, Tiger expanded from what was a national initiative to be an international committee, trying to extend its reach more globally. And in 2014, Tiger was lucky enough to be brought into the HIMSS family and currently lives within the Professional Development Department under the very supportive leadership of Joanne Kleindienst. In 2018, we transitioned to become an international task force, and Tiger now includes representatives from over 28 countries with 60 committee members and liaisons across the globe. Currently, Drs. Paula Proctor from the UK and Bob Brookshire from the University of South Carolina serve as co-chairs of this task force. So these are just some of the images that we have from the international reach that Tiger currently enjoys. We try to make use of all of the resources under HIMSS and professional development to disseminate the work that we do globally and also to inform people about Tiger and its mission. Okay, so we are going to do a couple of polling questions during this presentation, so let me do a little housekeeping around that before we go to the first question. You can actually touch the HIMSS mobile app on your smart device, select Schedule from the main menu, search for session 179, click on the session, and then you'll be able to click on polls in the top menu bar to vote on the 2 polling questions that we have. So let's move to the first polling question. We just want to understand a little bit about the people who have come to this presentation. We'd like to know, for the educators in the room, are you a health informatics educator? Are you a health professional educator? Are you an IT educator or computer science educator? And please understand, we mean educator to include people that do training within healthcare organizations, for vendors, or in any aspect of educating healthcare professionals to use information technology. So my husband's a veterinarian, and he often says, we educate people, we train dogs. So we'll give you a few seconds to respond to that before we click on the link and bring up the poll. So somebody can flag me when it's been 15 or 20 seconds. Okay, so let's see what we have here. Oop, I'm using the wrong. Okay, here, so let's see what we've got. So the majority of people here are health informatics educators, so we're kind of speaking to our own people primarily. Okay, and you know, we don't have time for interpretation. We'll just make the observation that the majority of people in the room are health informatics educators. What we'll try to do with this data later on is do more interpretive, and we'll try to make sure we disseminate that. Let me close that. Okay, now get to my next slide. Okay, so we all know that technology has changed dramatically over the last few decades. I mean, from the green screen or amber screen interfaces from the 1980s when I first started taking my computer science classes, we now have iPhones and iWatches and simple touch devices. And while the user interface is simple, there's an incredible complexity behind that that has really resulted in introduced errors and unintended consequences in using health IT. So we have to remember that even though the interface may be simple, we really have this kind of pull back the curtain on the land of Oz behind it that we have to be able to deal with. And that really the healthcare professionals that are using this need to be able to deal with to some degree too. And so what we know from that is that health IT in e-health education must be reinvented anew. We know that it's not a good goal to try to turn everybody into an IT geek. That's really not what we're talking about. But what we do know is that health IT education has to be about more than just using an EMR interface. You know, it's not just about where do I document the patient's blood pressure or which order set do I pick when I'm putting out orders for this patient. It's really about a systems level thinking, because healthcare itself is now about more than just an individual provider and a patient in an exam room or in a hospital room. It's really about having IT support the healthcare professional as an individual, but also as a member of a patient care team as healthcare moves towards a more interprofessional and interdisciplinary patient care model in a more IT-connected world. It's also about helping providers understand how to protect data in an increasingly bring-your-own-device world. We have to be able to educate healthcare professionals in how do I protect the patient data, how do I protect the privacy, and how do I secure the patient data on my device if I'm using a device of my own. We also need to provide training in data analytics and data visualization so that we can take these huge data sets that we're collecting and actually make sense of them to improve not only individual patient care, but population health, and to help the healthcare system actually achieve that promise of IT that we will be able to operate more efficiently and effectively. And finally, we need to help train healthcare professionals and healthcare organizations on how they can use health IT to engage patients, to bring them into the decision-making process, and how do we safely share patient data with patients, and what tools do we use to do that? Because really, we always have to remember that even though we're primarily IT people, patients are really at the core of what we're doing, and they're really why we're doing what we're doing. So excuse me while I flip my page here. We don't have a good notes view. So we've got these very lofty goals. How do we actually operationalize them so that we can decide what steps we need to take to actually achieve these goals or start moving towards achieving these goals? So we need to ask a lot of questions, primarily because we just like to ask questions. We're educators, we're researchers. We need to actually understand what are the highest priority health competencies that we need to be teaching health professionals. Why do they need to attain these competencies? Is it a real competency, or is it just a buzzword that's popular now that somehow got into what we're trying to do? What do we need to be teaching? Basic or advanced methods? What does each role need? How does it have to be tailored to what specific healthcare professional roles are doing? And then also, how do we deliver this content? What teaching methods do we use? And arguably, most important, how often do we need to keep rolling this content forward as this world of health IT that changes, like every time you blink your eye, moves forward? So we need to be more dynamic in our thinking of educational content than we've traditionally been in the past. Okay, so, all right, so now we have our second polling question. And so for the people in the room, if you've made use of educational recommendations from an organization, which have you done it? Have you used them from any of these organizations? And if so, which one? And I apologize for bundling AMIA and IMEA together, but the polling system only lets us have 4 options. So, you know, if somebody is here from those organizations, you can kind of come and beat me up a little bit about it later. So go ahead and select schedule on the main menu from the HIMSS mobile app, search for session 179, click on the session, and then click on polls on the top menu bar to select your option for the polling question. Okay, I think people are we ready? Okay. Let's see, where's my cursor? There we go. Oh, this is the wrong one. How do I get to the next question? Oh, okay, I'm not seeing the second one. No, this is the first question. Where's the second question? Yeah, I know, I'm not seeing it either. That's what I'm asking. Okay, why don't we just do a show of hands? As Tori suggested. So how many people have made use of AHIMA recommendations? Okay, I say maybe about 10 people in the room. How many people AMIA or IMEA? Okay, that's the bigger number so far. Takehome and HIMSS Tiger. Okay, let's say HIMSS Tiger is pretty well tied with AMIA and IMEA. Okay?
Yes. Yeah, it's good to know that there are so many educators in this room and so many of you are using and are familiar with educational recommendations. Now, Tiger had the opportunity to answer questions about priority of competencies and about interprofessionalism in 2 consecutive projects over the last 4 years. The first project was the International Competency Synthesis Project funded by HIMSS and the German government. It focused on core competencies for nurses in various roles nurses can take on, and and this resulted in the framework 1.0 for nurses. We called it Framework 1.0 for nurses. And the second project was the International EU-US eHealth project funded by the European Commission in the prestigious program Horizon 2020. And in contrast to the first framework, this framework was broadening its scope and looking at the competencies needed for different and multiple professions. So, how do I move on this? Both projects were rooted and utilized the same methodology. This is definitely a strength, and both projects were aiming to capture the global perspective and the local perspective. In order to capture the global perspective, we set up and sent out 2 surveys to high-profile international experts around the globe to rate the relevance of core competency areas. These results were then validated in workshops, and you might ask yourself, where do these list of core competencies come from? They come from existing well-known recommendations of professional and scientific associations. In order to capture the local view, we approached educators all around the world to share their educational and teaching experience with us and provide educational case studies, so to mirror the findings from the global surveys. Now, both strands, the global and the local, then were synthesized in the so-called recommendational frameworks. Before I go into the depths of Framework 1.0, I would like to tell you that all I'm saying and we are saying it has been published in an open access article, so you can easily download it and can read it. So it has been published in Methods of Information in Medicine, a well-known scientific and peer-reviewed journal. And here you also see all the authors from different countries all over the world. And I know there are several of them here in this room, and I would like to particularly acknowledge the contribution of Dr. Marion Ball from IBM and Johns Hopkins, from Toria Shaw, HIMSS, and from Polon, is this Polon over there? Yes, National University in Taiwan and China. The second framework has been submitted to MedInfo, the International Scientific Conference, which takes place in France this year, and it is still under review. Here we have additional authors in this room. This is Paula Proctor. We have Beth Elias, who is an author of this second framework. So, now it's time to have a look at Framework 1.0, and you easily understand why we are always talking about frameworks. All the findings are arranged in a grid. So, and I'm now moving the mouse. So what you see here is the lines where you have the core competency areas, and they were grouped in so-called domains. And here you see the domain DIK, which stands for data, information, and knowledge. And in the columns here, you have the various roles nurses can take on. It is clinical nursing, it is quality management in nursing, it is coordination of interprofessional care, it's nursing management, and it is IT management in nursing. Now the results come together at the intersection of both the lines and the columns, and here you find the relevancies for a particular role and for a particular core competency area associated with the related case studies. And here we have 6 case studies from the United States, from Brazil, from Scotland. We have case studies from Germany and from Taiwan, China. Due to the rigorous methodology used here for obtaining this framework, and due to the rich information, this is the Tiger framework. This is a new version of recommendation, and it's a truly unique approach to assist both educators and students to find their way through the jungle of competencies and provide them with a nice navigator and compass. Now let's have a more deeper look into the results, and I'm presenting here the results for clinical nursing, the relevance ratings, and you see here quite high relevance ratings, considering that the experts could rate them from 0 to 100. And for us in this room, this is definitely not surprising that there are so many core competencies with such a high rating. But if you talk to nursing educators and deans up and down the country, and not only in this country but worldwide, you'll certainly get a different picture. They still need to be convinced, and with recommendations such as the Tiger framework, it is much more handy and it's much more easy to convince them about the importance of e-health and health informatics competencies. Now let's move on to Framework 2.0, which has a more broad scope. And here again, you see many, many figures, so please don't get confused. I will not go into the deep details of this. Just for you to know, all these findings come from relevance ratings of 718 experts all around the world from 51 countries. And as I said at the very beginning, this is a multi-professional approach. So what you see here is different roles of healthcare professionals. Of course, we have, you don't see it on this slide, that's direct patient care, combining nurses, physicians, therapists, pharmacists. We have here health information management. We have executives in healthcare. We have, of course, the chief information officers and IT engineers in healthcare. And we have, last not least, on this slide, at the right bottom, science and education. There are many results coming out of these diagrams and tables. I'd like to just answer here one question, and this is, what are the competencies common to all or many of these different roles? And it is quite interesting, but it's not surprising that communication was among the top 3 in all 6 roles. And then we're coming to a result which is certainly new or partly new to us, is that leadership. Okay, well, that's still expectable, but ethics in health IT is among the top 10 for all 6 roles. And there are further results in quality and safety management, documentation and care processes, and IT integration, which were among the top 10 core competencies in 4 out of the 6 roles. So these are a core set of competencies shared by many different professions, and there are new competencies arising, emerging, such as data analytics, which is not surprising, knowing that data science is becoming more and more important, not only in this country. Again, the relevance ratings and the survey findings were mirrored by local case studies. Here you read global case studies, and we named it global case studies because they are coming from all over the world. By now we have 22 case studies from North America, from Europe, but also from Asian and African countries, and Beth will give you more details on this.
Yeah, so I'd just like to talk a little bit about the methodology that we used to put out the call for the case studies. And, you know, as anyone who's tried to recruit case studies is kind of a difficult task. It's kind of a thankless task to put together a case study, but they're incredibly useful, particularly in this situation where we're trying to take the Framework 1.0, the global competencies, and understand how those look at the local level and how they're actually functioning at the local level. So we started with an open call that focused on the EU-US Consortium network of networks, and to encourage people who did not speak English as their first language, we wanted to really have a global response to this. So it was stressed many times over that you don't have to be an English speaker to participate in this call. We then moved on to invitations that were extended to our participants and anyone who came to the project events or to any presentation about the project interim results. We then did an open call reaching out to universities and health IT organizations worldwide. Then we did an open call using Tigers and HIMSS's global network and listservs. And then we shared the information with global HIMSS communities to try to broaden our reach as much as possible. And as Dr. Hubner pointed out, this is an ongoing effort. We are still in the process of soliciting and collecting case studies. We'd like to collect as many as we can, hopefully. And so we're going to leave this call open for a while and work with people that would like to submit case studies. And we'll share some links at the end of the presentation so that you can actually go to the landing page for this project under the HIMSS Tiger page, in which you'll be able to see this data more clearly, and you'll be able to look at the case studies and the results of the Framework 1.0. Okay, so talk a little bit about the methods for the case studies. Like I said, it's really a challenge to solicit case studies, particularly since we did not offer journal publication as the carrot, as often can be given. So what we did to help encourage people to participate is, for people that contacted us about participating, we issued a formal letter of invitation to them from the HIMSS Tiger project. And then when we received the initial draft of their case study, and it went through the review process, we gave them a formal letter of acceptance, thinking that this would be something that they could use for promotion and their professional path. So also, all calls for participation also had a notice that a template would be provided and that editorial assistance would be provided in helping people refine and craft their case studies. We hoped that, in part, that would help people who are actually boots on the ground, not necessarily just associated with universities and academic institutions. So part of what the template helped us do was ensure that our studies, all the case studies that came back in, were in a uniform format that we could then compare to each other and then compare back to the competencies that had been identified in Framework 1.0. So editorial assistance was provided by the project team at Ursula's University in Osnabrück, by the Tiger leadership, and also the clinical informatics staff at HIMSS. Tiger committee members provided additional reviews, and then a final review was done by the HIMSS Tiger staff before a case study was accepted. So really, we did 4 rounds of reviewing and editing to help authors of the case studies really bring forward the richness of what they were doing in their areas. So we saw from that these studies provided empirical views into real-life contexts of what was going on in current state. It allowed competency evaluators, along with educators and people that were doing educational programs, to share what was working for them in their countries. We then looked to see, which we'll talk about later, to see if the case studies aligned with the major gap areas that were identified in the survey from Framework 1.0, and we found that the case studies did map very strongly to the 10 gaps that were identified, major gap areas that were identified in Framework 1.0. And so, as Dr. Hubner pointed out, this project was really the first to collect global case studies using a very rigorous and specified methodology so that we could compare the case studies. And so this is really a unique undertaking. Okay, so we have some case study highlights. We're just going to talk about a few descriptives of the case studies before Dr. Hubner goes into more detail on 3 that we selected to share. And so before that, though, a word of caution does need to be said in terms of case studies. Really, they can't represent an entire country. They are really just highlighting how an individual group or solution was executed within a country. So they can't really say that it's representative of the entire country. We have to remember when we look at the case study, this is one group within a country that's actually trying to make progress in this area. So they're really meant to ask questions about why and how things work or don't work. So that being said, we did find that the studies were very diverse but highly comparable, reflecting the real world. They identified key concepts and also included solutions and remedies to the gaps. They included exemplars and best practices for the education of the healthcare workforce, with 14 of the 22 studies being from Europe and additional studies from Asia, the Middle East, North America, and Africa. Okay. So, I think we have conclusions now. So, really our conclusions from this Framework 1.0 and the work with Framework 2.0 is that this methodology that has been developed really allowed us to propose two frameworks, a global and a local framework, and that the first right now, as Dr. Huebner pointed out through the Open Access Journal article and all of the white papers and the case studies that are available on the Tiger landing page, we can support HIT education not just for nurses but for all the professionals in the healthcare arena. The second framework, as she mentioned, will be shared hopefully later this year through MedInfo and some other avenues. And we know now that interprofessional education is really critical for health IT, and that we really need to address the top competency areas and gaps identified in the International Competency Synthesis Project, such as communication and leadership, and now ethics emerging as part of that, because HIT is a moving target and evolves at such an incredible rate that we can't really afford to think of solutions that we tried in the past. We have to kind of move forward into new areas of solutions and new ways of doing things and thinking about things. And part of that is identifying this framework for developing core competencies and understanding how they need to evolve over time.
So in the next couple of minutes, I'd like to make you familiar with some of the case studies. Beth already said it's 22 case studies, and we picked out and we choose those that come from countries with a highly advanced health IT infrastructure with high health IT adoption rates. And the curricula that are presented in these case studies address a multi-professional audience of students and health professionals alike, both fostering workforce development. So here is the first case study from the United States, provided by Gisette Jones, who is not in this room, no. This case study picked up an area certainly everybody would agree was a high urgency, that is the development and the implementation of electronic health records. Even though they are rolled out in this country, there is still a need for improvements. You see the skills and the knowledge, the competencies associated with this global topic, EHR, that are centered around. I do not want to go into the little details. We have all the information about the case studies on the Tiger landing page, so if you want to have a closer look, please, you're warmly invited to have a look there. The second case study comes from Israel, and was provided by Rachel Kay and her colleagues from Asuta Medical Centers, the largest private health system in Israel. And Israel is, I learned, a favorite country where they had rolled out electronic health records already years ago, almost decades ago. So they are in a position to have all patient data in an electronic form. And knowing this, it's quite understandable that they are looking ahead and they are trying to make use of this kind of data and want to use it for improvements in quality of care. And so it is quite understandable that Asuta health system was highly interested in continuing education and enabling their staff with regard to analytical skills so that they can make use of the data, analyze them, and become into a better position where they can draw consequences and, for example, improve their processes. Again, here you see the skills and competencies around data analytics. Again, I do not want to go into the details. Again, have a look at the HIMSS Tiger landing page. So finally, I'd like to present to you a case study from Europe, from the Baltic countries, that includes Finland, Estonia, and Latvia. All three countries are well known for their highly advanced health IT infrastructure. And here are the authors, Uti Ahonen and her colleagues, who presented this case study. The case study is remarkable with regard to two aspects. It has been funded by a European cohesion program. It is also remarkable because 3 units were developed in this program, and out of these 3 units, 1 was dedicated to the topic of ethics and health IT. Again, you see here the competencies that are associated with ethics. Now, actually, it's time to come to conclusions, which Beth already mentioned partly, but maybe you want to say a few more words on what we can conclude from our results.
And I think we can all agree that competencies and frameworks to help understand them are really a necessary thing, but they need to be based on a rigorous methodology if we're going to be able to use them effectively. And we really need to have, in addition to global findings, because healthcare is becoming more global, we need to have local exemplars for the case study so people can understand how to make them work in their own world. So interprofessional education is possible and necessary, particularly in the top areas that were identified for the competencies, some of which are old friends that have been around for a while, communication and leadership, some that are really emerging on the scene, ethics, quality, safety management, and care processes integrated with HIT. And so we're also seeing from the survey that we're seeing some new things kind of appear on the horizon for competencies, including data analytics, medical technology, and assistive technology. So, you know, when you think in terms of how rapidly healthcare changes, it's always going to be something that we have to look at, like what is coming down the pike? What are we starting to see kind of form in the shadows there that we're going to need to be developing competencies for so that healthcare professionals can keep being effective and work efficiently in this world?
So it's now time for a take-home message. And this message we would like to give aligns very well with what has been said at the opening session of this conference. So health informatics education is at the heart of quality of care and of transforming healthcare in interprofessional teams through the use of information and technology, because information and technology empowers the agents of change, the people such as you. Thank you for listening. And here are
I'm going the wrong way, sorry.
some more information about the references. By the way, Susan, are these slides made available to the audience? Yes, they are, so
okay.
We do not have to read it to you. Yes, and there is time for giving acknowledgements. We already mentioned the contribution to the article, but we also want to thank at this point of time 2 persons. I start with Toria Shaw, who is the heart of Tiger and who has been helpful in all our activities, in the easy activities as well as the more difficult ones. So thank you, Tori, for your assistance and help.
Right. Then we also want to acknowledge Miriam Ball, one of the founding Tigers and certainly a driving force still behind Tiger, and without whose vision and foresight in 2006, we wouldn't be here now.
So here are some final resources, our contact emails, contact information, and if you feel that you would like to contribute a case study and share your educational experience with us, then please either contact Beth or myself or Toria Shaw.
Any questions? Please, you can step up to the mic.
Go ahead. Okay, so first, with regard to the case studies, is there a template or something that
Yes.
you can provide for those who want to do them?
Yeah, we developed a template, and we also provide editorial assistance and a four-cycle review process. And so, as I said, part of this was to encourage people who wanted to be able to write in their own language and have us help them translate it into English so we could get a really global reach for that. So we're happy to provide that assistance.
And then following up on that, are there some particular gaps in your coverage of case studies that you would like to see filled?
Well, with the call for case studies, we didn't really want to, what's the word I'm looking for, bias the case studies that were submitted. What we looked for were case studies and then aligned them to see if they aligned with the gaps. So I think that's the process we'd still like to continue. If we just asked for case studies that fit particular gaps, if there was a case study out there that actually highlighted something we didn't see before, we would miss that. So I think we want that to be broad and open and help people share their experience with us, and then see if we fit it in, and if we don't fit it in, why doesn't it fit in? Do we need to look at something else again?
Thank you very much for the presentation. My name is Osam Al-Hassan. I'm coming from Dubai. So actually, I've been privileged to meet the Tiger team even in China and even in Europe before that, 2016. We learned a lot from your experience, and we got inspired actually by that, and we developed some sort of a regional group around GCC countries, which is UAE, Saudi, Oman, Bahrain, 6 countries. We developed a group called GCC Task Force in e-health workforce development. And one of our targets was to develop a survey around the competencies and the gaps in the workforce development in our region. And I'm very happy to announce that we developed a survey between...
Oh, sorry.
Okay. We developed a survey between November and January this year. And we got very good contribution from one of your collaborators. We got around maybe 600 responses.
Excellent.
So this is very important. I would like to share the data with you.
Yes.
And I think this would be good for a new
Yes.
case study. Yeah.
That would be amazing.
One of the questions, things that we realized through our study, that there is another group that you need to add to your scope, which is people who are working in the, I can say, funding and revenue cycle. So it's not only coding, but coding and also the linkage with insurance and the process of claims management. This is now becoming an IT, and it's now a specialty by its own.
Yes. Yes.
So I think they should be added to those groups.
Yes, I agree completely with you. And you know,
Thank you.
I can actually like show you where the case study template is, if anyone in your group would like to submit a case study. If you've got that broad a reach across 6 different countries, we would love to have 1 or 2 case studies developed about what's going on that would enrich our stash of case studies.
Yes,
That would be
thank you very
wonderful.
much.
Thank you.
Here is another question. Please, go ahead.
Assessment drives any curriculum, so you've done a good job of creating competencies, but in order to assess whether people have mastered them, some sort of assessment is necessary. And so have you given thought to how those get assessed? Because anything other than knowledge assessments tends to be rather challenging.
Yes, this is a very good question, and indeed it's an outcome question. I think it would be very well suited for a case study, because if we describe core competency areas, this is really the very, very global perspective. We wouldn't be able to assess whether somebody achieved the goals for these global core competency areas. But when you break it down, and this has been done in the case studies, so we have the core competency areas, and if you then move down to the level of the competencies, how every individual educator interpreted these core competency areas, then you can measure it. But I think we can think about this. This is a very good suggestion how we can think about it, maybe at a sort of an intermediate level, to find out solutions how to measure it without disregarding the local perspective. But definitely on the very top level, it is not feasible. But thank you, that's very good, thank you. Yes, please.
Presentation.
Yes.
And talking about competencies, right before you started presenting, I was just brainstorming some ideas of how HIMSS could actually help us tracking those competencies through the program that's in place about academic partner provider, where you have to meet certain criteria to be able to provide certification through HIMSS. And I was thinking, why not partner with HIMSS and Tiger, so we provide incentives for academic institutions or programs to actually become an academic partner provider through Tiger, and not, it's going to be part of HIMSS, but we can come up with our own competencies that Tiger works so hard on that would be actually helping us track them from the beginning of the program when a student enters to the end. I'm kind of modeling this idea with internships that my students have to complete, but I think this can be a whole new initiative driven by the Tiger community. We're going to talk more tomorrow.
Yes. Okay.
Yeah, I think part of the richness of this project is that there is so much potential for what we do with what we've developed and what we've found. And so I think in presenting here today, this is part of our purpose, is to start talking about that and how do we actually start disseminating this and making this available to educators regardless of their setting. So I think that's definitely the logical next step. I think that's the end of our questions, so thank you for your time and attention. We appreciate it, and thank you for the polling questions.
Thank you.
Feels like fire. I'm so in love with you. Dreams are like angels. They keep bad at bay, bad at bay. Love is the light, scaring darkness away. Yeah. I'm so in love with you. Purge the soul. Make love your goal. The power of love, a force from above, cleaning my soul. Flame on burn desire, love with tongues of fire, purge the soul, make love your protect you from the hooded claw. Keep the vampires from your door. When the chips are down, I'll be around with my undying, death-defying love for you. Envy will hurt itself. Let yourself be beautiful.